Good day, everybody. So my name is Tumelo, and in today's lesson, we'll be learning about substance abuse. So without any waste of time, let's get into our topic. Yes, as I've said, we're going to learn about substance abuse. So, what is substance abuse? We need to learn what is substance abuse, what are the causes of substance abuse, what are the symptoms, how do we see that a person um, it's a person who's affected by substance abuse, and also what are the treatment, how do we treat it. I mean, if we've got people that have got this problem, how do we then help them to become themselves again? So yes, our objectives. What are our objectives? Our objectives by the end of this lesson is that we need to be able to define what substance abuse is, and also to identify the risk factors and productive and protective factors associated with substance abuse, those such as alcohol, drugs, and also we need to learn about various drugs. So yes, let's get into it. What is substance abuse? So, substance abuse is also called a drug abuse. This is an illness that is characterized by a destructive patterned use of illegal or legal drugs or even medications. So this is the use of drugs in amounts or by methods which are harmful to the individual, and also it is a form of substance related disorder. So drugs often related or associated with a term substance abuse includes alcohol, as I've said already. It includes cocaine, substance abuse, and also the condition affect the person's brains. So, what substance abuse does to a person is that it affects their brain and behavior in such a way that they are unable to control the use of drugs to a point that it interferes with their ability to function. So you find a person who's affected by substance abuse, you find that they are unable to just do their day-to-day basis duties. Like those people, they're just not themselves. So, and there are also people that, like, you'd find them having certain cravings. You'd find them physically ill, not themselves. Like they just become totally different people. So, and also the with the stats that has been done, it shows that there are over 190 million drug users around the world, and the problem keeps increasing at an alarming rate, especially among young adults under the age of 30. So, a lot of people which are affected by substance abuse, there are people under the age of 30, which is very sad because that clearly shows that um, the future of our young ones, it's in danger because of this drug abuse. So drug abuse can cause a long-term damage to the body. A drug addict who uses the needle at a much risk of having HIV and also hepatitis B and C infections. So these people, they oftentimes become reckless with their lives in a point that they not like they just have unprotected sex wherever they go, or some they've given up with their lives. And also moving forward, so people start to use this drug for so many reasons. So what do you think are the reasons that people start using drugs? Let's get into it. So many people start using the drug, thinking that they're just experimenting. They're just doing it out of curiosity. That those people, they're just like, okay, I just want to feel. I just want to feel how it is like, what it feels like to be to be using drugs, not knowing that they're going to get affected by it, and also they're going to get addicted, and then they end up not getting out of the situation, or else they just got into it in the minds of what, in minds of just experimenting, and just something that they just going to do for a certain period of time, and then they get rid of it, and then they stop it. But some they end up using those drugs and then not managing to leave them, so they end up being addicted. And also some others, they start using drugs, and people, they become addicted, not because of friends, not because of experimenting or whatsoever. Some will be becoming addicts because of the medication prescribed for them at the hospital. And mind you, remember, the hospital only prescribed the medication for you to help you feel better. But once you start taking the pills time and again, even when you're not supposed to, then you end up being addicted. And in that way, you'd end up being addicted just because of the medication that was prescribed to you by the doctors whom were trying to help you. So an attempt to stop the drug use may cause intense craving as well as getting physically ill. So other people, they become ill when they stop the drugs. Some other people, they become they crave things that they do not normally crave when they are sober. So yes, just be careful. So, and then that one is the stat. Or just before we move along, I need to discuss the picture there that you see on your right corner. So that picture, you can see the person's leg is tied to the container of pills inside. So that is just me simply saying some people, they are addicted to a point that they cannot live without pills. So they feel like wherever they go, they need to take their pills. So those are the people that are addicted, and we need to be careful of those ones. So what are the causes of drug abuse? We've already mentioned a few. If you think about it, I mean, each drug product different. Okay, each drug produces different physical effects on the brain. However, repeated use of drugs can change the way in which the brain functions. So you no longer become yourself. You lose your mind, including the way the brain feels pleasure. So you feel pleasure. Some they call it pleasure. Of course it is, but it's not healthy. So we just need to be careful of that and make sure that we try by all means to avoid such things. So it is because of the changes in the brain that is so challenging for an addicted person to stop taking drugs. And lastly, what are the main factors that contribute to substance abuse? Genetics, environmental factors such as parental abuse and or neglect, so family beliefs, exposure to peer pressure that encourages drug abuse. So early use of drugs, that can also be the cause of substance abuse. Peer pressure, we've already mentioned it, we've talked about it already. Unstable home environment, so where you coming from, I mean, that can have so much impact on your life, and also could be the reason why you get into drug abuse. So poor performance at school, so if you don't perform good at school, you end up thinking, maybe school it's not for me. But hey, that's just people who end up getting into substance abuse because they just have such mind thoughts. Poor relationship with parents, they do not have a relationship with their parents. And then other factors include depressions, anxiety, bipolar disorder, personality disorder. So there are different things that can cause substance abuse. So moving along, I've just got a picture there which shows a person who's affected by substance abuse. So what are their cravings? What could tell that this person is addicted? Okay, firstly, let me just put my cursor there so that you can see. So this person here, you can see that, people with substance abuse, you can find that the person is craving the use of the substances. They just can't be themselves. Like they're not themselves. If they don't use the drugs, they feel like okay, they need to take something for them to be okay. So cravings to use substance abuse, wanting to cut down or stop but not managing to. So some people, they try to stop this substance abuse, but they don't manage because they are addicted already. That's how you can tell when a person is addicted. So taking the substance in a larger amount or for longer than you are meant to. So these are people that oftentimes get addicted because of the medication that was prescribed to them at the hospital. So instead of them taking medication that they're supposed to, they end up overdosing, and that clearly gets them into substance abuse. And then we also have these others here by the side, so just check them out so that you also understand it fully. So these are my symptoms, which I've already spoken about in that picture. And then what are the diagnoses? A thorough evaluation that includes an assessment by a psychiatrist or psychologist or a licensed alcohol drug counselor may be required for diagnosis. So blood or urine or other lab tests are used in the process in the assessing drug use, but they do not serve as a diagnostic test for substance abuse. And also, what our treatment? With the right treatment and support, it is possible to counteract the disruptive effect of drug use and regain control of your life. So you just need the help from the doctors and also family members. They can also help you to become yourself again. And also the primary goals of treatment are obviously abstinence, relapse prevention, and rehabilitation. And other treatment options may include chemical dependence treatment program and detoxification and behavioral therapy. So I believe that is our end of lesson. And yes, by now you should be knowing what is substance abuse, what causes it, and what are the treatment. And lastly, just say no to no drugs. It's of no use to ourselves because we end up losing ourselves. So just say no to drugs and